Hello, namaste, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring experts from Apollo hospitals to the live show. You are watching this on the YouTube channel of Apollo 24/7 and the Facebook pages as well. If you want your queries to be answered, you can place your question in the chat box of YouTube channel of Apollo 24/7. I'm going to take the question up and place it before the expert, and we will bring you a solution for your question or the query. On this show, we are going to have a health quiz. We are going to give away discount vouchers and coupons which you can use on Apollo 24/7 app. So I urge you to download the Apollo 24/7 app where you get the benefits of buying medicines, consulting doctors, booking lab tests, and taking all your records into one place and consulting physicians. Actually, there's a column where you can consult on the Apollo app. You can consult actually a physician for free. Yes, you can go ahead and see if you can find a virtual consult for free on Apollo 24/7 app. And Apollo 24/7 also, let me remind you, has started a 19-minute delivery, instant medicine delivery in Noida, Gurgaon, and Hyderabad as well. Also, the entire country is this offer is going to be expanded around the country in a few weeks' time. But if you want to participate in the contest where you can give the advertisement or the creative ideas, go to the LinkedIn page of Apollo 24/7 and you'll find the announcement there, which is made by the COO of Apollo 24/7, and you can participate and win almost up to 50,000 rupees worth of gifts. So that is all about Apollo 24/7 app. And now let me talk about the topic that we are going to talk today. How to cure sinusitis. What is sinusitis and how do we help somebody who has sinus? Today, we are going to be joined by an expert ENT specialist from Indraprastha Apollo Hospitals, New Delhi, Dr. Noor Malik, who can be consulted for broken nose, throat infections, the tube dysfunctions, hoarseness, laryngitis, nasal and sinus allergy care, vocal cord cancer, etc. And here the doctor is Dr. Noor. Welcome to the show.
Thank you, Jhansi. Hello, everyone. I am Dr. Nooruddin Malik. I'm a senior consultant at Indraprastha Apollo Hospital, New Delhi. So you just feel free to ask any question related to the sinusitis, the topic today.
Wonderful, doctor. Welcome once again to the show. It's wonderful having you on
Thank
a
you.
Sunday morning. We appreciate the time that you have taken to give this empowerment to our viewers here. So let me
My pleasure.
basically start myself. I've been going through my childhood was lined with episodes and repeated recurrent episodes of sinusitis, and I understand the pain. I have gone through this, so I can personally say that I can relate to most of the people's pain out there. So let me ask you certain basic questions before we start. Sinus
Okay.
कहाँ है और क्या है?
So basically, sinus जो है, a lot of people have this misconception as probably the nose is the sinus. It is not. Sinuses यहाँ पे hollow spaces है, multiple sinuses होते हैं यहाँ पे, यहाँ पे, यहाँ पे. हॉलो स्पेसेस हैं जो एयर फिल्ड होते हैं जिसमें हवा होती है. द पर्पज इज कि स्कल को जो नेक को वेट बियर करना है स्कल का, अगर पूरा हार्ड होता तो डिफिकल्ट होता. तो टू मेक इट लाइट, सो वी हैव दिस एयर फिल्ड हॉलो स्पेसेस व्हिच वी कॉल्ड एज द साइनसेस.
Okay, so these are the hollow spaces, but ये hollow spaces located किधर किधर है?
So there are two sinuses here, we call them maxillary sinuses यहाँ पे. There are two sinuses here, we call them frontal sinuses. On each side of the nose there is a partition in the nose, we call as septum. इसके दोनों तरफ यहाँ दो maxillary. Then there is a labyrinth of sinuses, multiple sinuses, we call them as ethmoid sinuses, which are categorized further into anterior and posterior group. And then there are sinuses behind, just below the brain, which we call as the sphenoid sinus. They are
अच्छा,
separated
तो
also by a partition. Yeah.
ओके, तो साइनस तो हम अपने एनाटॉमी में, फिजियोलॉजी, जो बॉडी हमारा जो भगवान ने बनाया है उसमें एक पार्ट है. एंड
जी
इसका कुछ फंक्शन, स्पेसिफिक फंक्शन है क्या डॉक्टर नूर?
बिल्कुल है. मैंने जैसे बताया है, अगर नेक को वेट बियर करना है हेड का, इफ एंटायर स्ट्रक्चर जो है अगर हार्ड मास का होता तो बहुत हैवी हो जाता. इट वुड हैव बीन ए वेरी डिफिकल्ट थिंग. बट गॉड ने क्या किया है, इसको जस्ट टू मेक इट लाइट, नोमैटिक स्पेसेस वी कॉल देम, और एयर फिल्ड स्पेसेस हैं, सो दैट इसका जो ओवरऑल वेट है वो कम हो जाए. इस वजह से उसको बनाया हुआ है.
तो ये जो हमारे डिस्चार्जेस है, जो काइंड ऑफ, बिकॉज आई हैव एक्सपीरियंस्ड दिस काइंड ऑफ पेन, तो मैं बता रही हूँ जैसे कोकोनट के अंदर पानी ऐसे हमें फील करता है कि मैं मूव कर अंदर
Exactly.
मूवमेंट फील करते हैं. दिस इज व्हाट एग्जैक्टली आई यूज्ड टू फील एज अ चाइल्ड. द मोमेंट आई यूज्ड टू बेंड माय हेड फॉरवर्ड, आई यूज्ड टू हैव वेरी हेवी फ्लूइड सामने आ रहा है, ऐसा फीलिंग मुझे होता था. सो इज
जी.
देयर एक्चुअल फ्लूइड which is filled in these sacs?
So normally what happens is these sinuses are lined by mucous membrane, which secrete mucus. So वो mucus जो है, and these sinuses have drainage pathways. So वो
अच्छा.
drain भी होता रहता है simultaneously. That lining has small hair-like structures which we call as cilia. So there is a constant propelling movement which we call as a nasociliary action. उसके through वो जो mucus है वो drain भी होता रहता है through that sinuses. So, but whenever
अच्छा.
we get exposed to an outside allergen या कोई भी infection होती है, तो drainage pathway gets blocked and there is retention of those secretions inside the sinuses, which we probably feel whenever during your childhood.
Okay, that must be the reason.
It's an
So yes,
intricate, it's an
sinus.
intricate mechanism here.
I'm sorry.
It's a very intricate thing.
Ah, and then when is it called sinusitis?
Yes. So when this entire lining of the sinuses, जो mucous membrane है, जितनी भी sinuses की lining है अंदर वाली, जब वो inflame होती है in response to an allergen या फिर infection की वजह से या फिर any reason जहाँ पे उसकी mechanical ventilation नहीं हो रही है because of deviated nasal bone या नाक में polyps हैं किसी वजह से भी, so when it becomes inflamed, that is called as sinusitis. Itis means inflammation.
Hmm. So, if I remember well, as I my age progressed or my awareness increased, the episodes or recurrent episodes of the sinusitis काफी कम होते आए हैं. So, ये episodic होते हैं क्या? And once the episode starts, will it go away on its own, or do I need to interfere with some kind of treatment?
Sometimes it can go on its own. Reason being because there is a desensitization process which is going on parallelly. What happens is when you are exposed to an allergen for the first time, if you have allergy to that, atopy to that, so if you're exposed to the first time, so there is a response from the body considering it as a foreign thing, and it responds is in the form of sneezing and running nose. The body recruits certain cells there to just throw it off. सो दैट रिस्पॉन्स बिकम्स ओवरवेलमिंग. आप बहुत ज्यादा जोर से छींके मारना शुरू कर देंगे, नाक से पानी आएगा ताकि वो एलर्जन जो लाइनिंग के कांटेक्ट में आया है बाहर हो जाए. सो इट इज बॉडीज डिफेंस मैकेनिज्म, बट वो समटाइम्स डिफेंस मैकेनिज्म इतना ओवर एग्जैजरेटेड होता है कि हमें खुद हार्म करना शुरू कर देता है. But when the
Correct.
same allergens comes in contact with the nasal lining next time, that response is not that like first one. The body will gradually start recognizing it as its own. So that
Okay.
response will start diminishing, and we call it as desensitization process. That is why some people it may go over a period of time.
Okay, that's interesting to observe. तो common अभी sinusitis कब कहाँ जाए? When do you call it actually a sinusitis? क्या क्या symptoms को हम बोल सकते हैं कि your sinuses are inflamed?
Okay. So the as far as symptoms of sinus, we broadly पहले तो हम इसको categorize करते हैं. Seasonal allergic sinusitis है जो seasonal है या perennial है या throughout the year हो रहा है या particular seasons like spring and winters में हो रहा है. Then symptoms of sinusitis में जैसे excessive sneezing होती है. I'm talking about allergic sinusitis. Then I'll come to the other sinusitis forms also. Sneezing हो रही है, running nose हो रहा है. Location of sinuses inflamed है, that they may have facial pain also. And if you touch it,
हाँ,
it may become tender. Headaches होते हैं
tender.
पेशेंट को. Yes. आई के अराउंड हैवीनेस होती है इन पेशेंट्स को. एंड nasal blockage होता है because of the congestion. So all these symptoms are there in sinusitis.
Right. So it is the frontal headache, it is touch sensitivity, it is heaviness in the face, it is pressure in the face, and also running nose, sneezing, and all other
Yes,
common
yes.
like
And
symptoms.
one more,
So,
sorry,
yeah,
sorry to
please,
interrupt.
doctor.
One more important symptom is loss of smell sensation or
Oh,
reduced
yes.
sense of smell sensation. Yes. So
Correct.
that can also be there. I'll come to that later on at the explanation, but it can be there.
Right. So, can I now ask, all these symptoms are present in any of the kind of cold which is caused by a viral infection or any other contagious infection? अगर ये खाली एलर्जिक का साइनसाइटिस है या कोई और साइनसाइटिस भी होता है क्या? Can this be contagious?
Yes, if it is a viral sinusitis, whenever you are in close proximity to that person suffering from the sinusitis, if he sneezes, there will be a drop spread of droplet infection. It can the other person, if his immune system is not capable of handling it, that person may also catch it.
Okay.
But this
So,
is in
if that is
particular
a
of
viral,
viral. Yes, yes.
why? तो एलर्जिक साइनसाइटिस में क्या होता है? इज दैट कंटेजियस? क्योंकि
No,
काफी
it is
सारे
not contagious.
मेरे इट इज नॉट कंटेजियस क्योंकि आई
No.
हैव बीन थ्रू इन माय चाइल्डहुड. आई रिमेम्बर हमेशा मेरा तो रनिंग नोज ही रहता था, हमेशा स्नीजिंग ही रहता था. सो थ्रू आउट माई स्कूल एपिसोड्स ऑफ अबाउट्स ऑफ कोल्ड रहते ही थे. सो आई wasn't
No, it is not.
aware if I. No, it isn't. All right. So next, I will start off with the questions from the audience. आज तो काफी सारे लोग questions पूछ रहे हैं, so let me start off taking questions. The first question that I want to take is Mr. Rampalli Ravichandra, who is from Hyderabad. I am from Hyderabad, but I went to North India. I suffered a lot because of climate and weather conditions, which are different from South Indian climate conditions. So, all these same symptoms, जैसे हमने बताया है, उनको same symptoms हुए हैं. So, is this a place change, or can this also trigger a sinusitis?
Yes, absolutely. So these sinuses or the lining of sinuses have receptors which which can get inflammation or because of the variation in temperatures, different places have different allergens in air. So if that person has atopy to particular allergen, if and he visits that place, he may get episodes of sinusitis or the symptoms of sinusitis like running nose, sneezing, and all those things.
So, ऐसे जो साइनसाइटिस होते हैं जो जोग्राफिकली या सीजनली होते हैं, कैन वी अवॉइड देम?
Yes, we can avoid them. Better is to, the barrier method is the best method. Whenever you visit places which are heavily polluted, or where you feel whenever you get exposed to a particular environment and you start sneezing and running nose, you can wear a mask there. So that's called the barrier method, or you can keep rinsing your mouth, what we call as a nasal douching. So you can do that just to rinse out or wash out the allergens which come in contact with your nasal lining.
So first and foremost, अगर आपको पता है कि ये cold या there's some kind of allergen which is causing, तो barrier, that is a mask, which should be the first round of help.
Absolutely.
That's that's interesting. So here's Mr. Akash's question. Good morning, doctor. I have troubles on regular intervals in my nose and ear. Intervals, okay. Ear gets filled with liquid wax while I'm sleeping, which causes itching and pain. Nose is very delicate with whenever I'm exposed to cold and dust. So ये connected हो सकते हैं क्या? Sinusitis and ear pain ये
Yes.
connected होते हैं?
See, what happens is this backside of the drum, which we call as the middle ear, it drains. There is a pressure equilibrating system, and it is connecting with backside of the nose through a tube, which we call as the Eustachian tube. A lot of patients or lot of people experience sudden earache while flying, and particularly during descent. That is because of this. So, whenever there is an inflammation in the lining of nose or sinuses, and the tube which connects ear with the nose, it opens at the backside of the nose. That's also opens there. So it can also get blocked. Because of that blockage, they can have ear problems also.
Right. So, may I request all the audience who are joining us to please do type in their age, gender, and who they are asking this question for, and all possible details into one question so that we can place all the facts before the doctor. It's getting difficult for me to scroll down, search the question, and gather all your queries together. Anyway, next question that I want to take up is: are there any vaccinations for sinusitis? This is asked by Mr. Dasari David.
There is no specific vaccination for sinusitis as such because sinusitis is of many types. But the viral infections the sinuses catching these viral infections, sometimes we have these flu vaccines which come yearly. A different variant every year is made. We call it an Influvac Tetra, or it is a quadrivalent vaccine which has four antigens in it. So you can get it done yearly, or even sometimes 6 months also if the severity of the symptoms is severe.
Right. So, the next question that I want to ask is Kanubhai Fatnani, how to prevent sinusitis and can we avoid allergic rhinitis?
See, there is, if you ask me, prevention definitely is there. As I told earlier, also, the barrier method, avoiding contact with the allergen is the best method to prevent it. And how do we do it? By using a barrier like in the form of a mask or any cloth or anything. And second thing, if at all it comes in contact with the nasal lining, we do nasal douching or jal niti, we call it, so that it gets washed away from the nasal cavity or the sinus lining.
Right. So, can we spend some more time on nasal douching or jal neti? Because what is the treatment for sinusitis? Karke, a lot of people are asking. So, can you please explain how nasal douching is going to help somebody and what's the right way to do it? Frequency.
All right. All right. So I'll come to before I go actually onto the douching. So I'll just move a bit behind and I'll talk about types of sinusitis first.
Ah,
So
that'll be.
types of sinus, yes. So we can have some people have this acute sinusitis, subacute sinusitis, and chronic sinusitis or rhinosinusitis. So it all depends upon the duration of the sinuses. If it is for 2 weeks or more than 12 weeks, more than 3 months, we call it, it becomes a chronic sinusitis, which is further categorized into whether it is because of the allergy, we can call it as allergic rhinosinusitis. Sometimes patients are immunocompromised patients, like diabetic patients, patients infected with HIV. So they have their and patients receiving chemotherapy. They are immune compromised patients. They can have fungal infection of the sinuses, which we call as the invasive fungal rhinosinusitis. It is a
Oh,
life-threatening condition. You must have seen during COVID, a lot of patients of
black
black fungus.
fungus.
Yeah, so
Ah,
that is also a type of sinusitis. So the patients who are in organ post organ organ donation, like post kidney transplant, post liver transplant patients, they need to take extra care. They have to wear a mask because their immune status is slightly lower than the normal individuals, and they are on immune suppression, so they can catch these infections quite easily, and this can become a life-threatening situation. So the other sinuses, we broadly categorize them into sinusitis with polyps and sinusitis without polyps.
okay.
What are polyps now? Polyps are grape-like structures inside because of the constant inflammation of the nasal lining. There is outpouching, so which leads to formation of these grape-like structures, which we call as the polyp. They are so basically mass. अंगूर के गुच्छे के जैसा मास नाक के अंदर डेवलप हो जाता है. So what is the treatment? So those patients have constant facial pain, loss of smell sensation because smell cannot reach the olfactory area. जहाँ से स्मेल हमारी कैरी होके ब्रेन में जाती है उस एरिया तक स्मेल पहुंचती नहीं है. And blockage in the nose, constant dribble, difficulty sleeping, and life becomes terrible. It affects the quality of the life. So what is the treatment for those patients? So the treatments for those patients is steroids, medical treatment, but we cannot give them steroids orally for a prolonged period considering the adverse effects. So what we need to do, they are patients in whom we do a procedure called endoscopic sinus surgery. We remove those polyps, make the sinus amenable to intranasal steroids, which are quite safe to use. They're topical sprays. They don't get absorbed in the body even if used for a prolonged period. And along with that, douching, we do it multiple times in a 3 to 4 times in a day, so that any allergen which has incited that reaction in the sinuses, to wash it out, we use douching. Nowadays we have pre-mixed douching sachets which come, and we just have to mix them in the water and rinse our noses multiple times in a day.
Yeah. So ये जो douching के लिए any specific equipment requirement होता है या you can do it on your own at home?
We can do it at our own also. We can use a if you don't have it, there are pre-made squeezable bottles which come also. But if somebody doesn't want to buy it, just lukewarm water, add some pinch of black salt and soda bike or the pinch of it, and use a 10 cc syringe and use it from both nostrils. So it is a very easy way to rinse your nose.
ऑलराइट। तो अभी जो नेजल स्प्रेस मिलते हैं वो सेम यूज हो सकते हैं क्या डॉक्टर? आर दे
बिल्कुल।
सेम एज
There are
douches?
Yes, there are different type of nasal sprays. Different companies have come up with saline nasal douching. Saline is sodium chloride, and sometimes it is mixed with sodium bicarbonate also to break the thick mucus plugs which are blocking the sinus passages. So they are pre-mixed and in the form of sprays also. We can use it multiple, 3, 4 times in a day, each side of the nostril, two puffs. So that's an easy way out.
Right. So people like you, for example, who are living in Delhi NCR area, which are AQI is very poor and actually
Yeah,
alarming, and
absolutely.
Mumbai is also catching up very fast. Other cities are also catching up really fast. So any particular triggers that sinusitis के triggers तो वो है ही. So what should they do
बिल्कुल.
as a regular constant precautions?
See, whenever this peaks, particularly during winter months, there's a lot of smog in around. The allergen quantity in the air, it becomes tremendous. So whenever you move out of your houses, please wear a mask. Please wear a mask. Okay. And second thing is, during these times, particularly, you should not be doing strenuous activities, outdoor walks in the parks, extraneous activities in the gyms unless you have air purifiers placed there. So air purifiers can save you up to some extent on say because you can't carry it all around. So
Correct.
whenever you're in a room sleeping, it is preferable to use air. At least some amount of air gets filtered, and the amount of allergens which come in the contact of the sinus lining, they become less. So and hydrating yourself is very important so that they get flushed away. Again, douching your nose is important, particularly patients who are prone to getting recurrent episodes of sinusitis. They should be doing douching and all. So these are the simple ways to keep your eat healthy also to keep your immune status healthy and so that it gets a boost and to fight these allergens.
Right. So here's Mahita's question, Doctor. Mahita did not have sinus earlier, an episode of sinusitis earlier, but suddenly they have developed cold and nasal congestion and headache near the frontal area. Problem got resolved in 3 weeks, and her question now is: will allergic sinusitis recur? अगर recur होता है तो what to do for severe frontal headache? Will there be any problem to the eyes?
See, if it is a full-blown, well-developed frontal sinusitis, it can complicate also because the surrounding structures are brain and eyes. But if it is a one episode which has happened, probably it could be a viral sinusitis which has led to inflammation of the lining, blockage in the drainage pathways, retention of mucus and other things. So that usually resolves. But if it is allergic and if she comes in contact with that allergen again, this is bound to happen. So better is to take precautions, wear a mask whenever she's moving out, avoid pets at home. Whenever there is dusting or fumes in the kitchen, better is to wear a mask.
Right. So Akash is 35-year-old. He has already asked this question, but in continuation to the last question that he's asking, last year he had severe sinusitis with the same symptoms that we are talking about: extreme pain near the eyes, and I had taken medicines after consulting doctor for 1 week. After that, surgery was prescribed if the situation did not get better. So, what is the surgical option, and who should be considering this?
Yes, yes. So the patients who have this constantly blocked sinuses, there is persistent nasal blockage because of the deviated septum or the central partition of the nose, they get hampered sinus ventilation. So to correct it, and sometimes patients can develop, as I told you earlier also, they can develop inflammation of the sinuses leading to edema. Edema is swelling of the sinus lining, which leads to blockage in their passages. So those patients need a sinus surgery or endoscopic sinus surgery. It's a minimally invasive kind of surgery wherein we go there, we dilate or we widen the opening of the sinuses so that the drainage is restored again. There is a newer
Right.
modality of treatment also in a select group of patients with isolated sinusitis like frontal sinusitis, or we can club it with endoscopic sinus surgery also. We call it balloon sinuplasty. Balloon sinuplasty is there is a balloon which is placed endoscopically at the opening of the sinus and it is dilated so that the drain. It is an extremely minimally invasive procedure, which causes restoration of the drainage pathway again. So those are the patients, or if a patient having any mass or tumor in the nose, which is causing this blockage in the drainage pathway, those also need treatment.
Right. So that is about Akash and Rampali Ravichandra, who was from Hyderabad and who had gone to North India and had episodes of sinus. He is now texted back saying that he had FESS septoplasty surgery in the year 2002 and septal deviation surgery in the year 2004. His age is 34. So now after the surgery, इनको कोई complications हो सकते हैं क्या?
See, it's a very routinely done surgery. FESS means functional endoscopic sinus surgery with septoplasty means the word functional means we have to preserve the mucosa or the lining of the sinuses. We just have to remove the diseased part. We have specialized instruments like microdebriders, which are very, refined instruments which help in preservation of the normal mucosa, so that the normal nasociliary action or the action which the function of the sinus remains the same, whereas we remove the drainage, this diseased part, and the drainage is restored. Whereas septoplasty means correcting this deviation. The central partition, sometimes it is crooked, blocking the ventilation of the sinuses. So we just fix it in the center so that the ventilation and the nasal blockage goes away.
Right, this is the surgical part and who requires
Yeah.
surgical help. आपने बहुत ही आसानी से समझा दिया है. But if somebody is not yet, I mean, say if they are not qualified for surgery or they are not yet ready for surgery, what are the options other than douching? Severe pain, any medications which are available?
Yes, it all depends upon we have to see whether it is an infected or a bacterial or a viral sinusitis. We have to see there are certain signs and symptoms. We have to examine them. We may have to do a nasal endoscopic at times because some patients with super added bacterial infections they have purulent or pus discharge in the sinuses coming out. So we have to give them a course of antibiotics. We have to do douching, and to relieve the edema or the swelling of the sinuses, we can put them on intranasal corticosteroids also for a prolonged period, which are very safe option. And sometimes if they have polyps, but which are not that exuberant growth of polyps, we can put them on a short course of oral steroids also so that polyps shrink. And whenever we plan surgery, we have to give the patients, unless it is contraindicated, we have to give them a short course of steroids to shrink the polyps, then get the CT scan to get the actual picture, and then operate on them if there is residual disease still there. This is very
All
important.
right.
We don't have to straight away go
With
for surgery if we have polyps.
correct.
Yeah,
Yeah. So here आपने एंटीबायोटिक्स का रोल मुझे पूछना था आपसे कि
yeah.
लाइक एनी अदर इन्फेक्शन साइनस को भी इन्फेक्शन या इन्फ्लेमेशन को भी इन्फेक्शन की तरह जाना जाता है क्या आर एंटीबायोटिक्स प्रिस्क्राइब्ड इन द ट्रीटमेंट कोर्स ऑफ साइनसाइटिस.
Absolutely. So what happens is sinuses, as I told you, they are hollow spaces. So when there is stasis of secretion, जब उनके ड्रेनेज पाथवे रुक गए, वहां पे जो म्यूकस है वो जमा होना शुरू हो गया, उसके ऊपर सुपर एडिड बैक्टीरियल इन्फेक्शन हो सकता है. Then that mucus becomes pus. So once you see frank pus coming out of the sinuses, you have to treat it with antibiotics. Patients will have signs of fever होता है, पोस्ट नेजल ड्रिप होता है, कांस्टेंट कॉफ रहती है, रिकरेंट चेस्ट इन्फेक्शंस होती हैं. इवन पीडियाट्रिक एज ग्रुप में भी ये पोस्ट नेजल ड्रिप की वजह से बिकॉज ऑफ साइनोसाइटिस, बिकॉज ऑफ एडिनॉइड्स, दिस कैन हैपन.
Yeah, so this is not for every sinusitis. Not all
No, not for
sinusitis
everyone.
require antibiotics. This is for the
No,
severe
no,
forms with secondary infection, which is leading to chronic sinusitis, not for every
absolutely.
sinusitis. थैंक यू सो
True.
मच बिकॉज हमारे यहाँ
Welcome.
इतना एंटीबायोटिक का वाइड स्प्रेड मिसयूज है दैट वी नीड टू काउंटर दिस every now and then, which is very important.
Absolutely, I agree with you on this.
Yes. Doctor, here's another addition from Mr. Kanubhai D. Fatnani's question. As he earlier asked, how do you treat sinusitis? He's 76-year-old from Mumbai. He's suffering from allergic rhinitis and sinusitis since last 5 decades. Can you please suggest a few names of the nasal sprays? दिस इज व्हाट इज आस्किंग सो ये एज में इतने सालों से अगर कोई सफर करते हैं उनको क्या लॉन्ग टर्म ट्रीटमेंट हम दे सकते हैं एंड व्हाट इज अ सेफ ट्रीटमेंट फॉर द सेप्टुजेनेरियंस
Yes. So, elderly people, we have to treat everything with a pinch of salt. We have to know their comorbidities, whether they are diabetics, hypertension तो नहीं है, any cardiac ailment, वो सब चीज़ें mind में रखते हुए, but as a safer option, even in them, we can put them on intranasal corticosteroids and saline nasal douching. Saline basically to clear off the allergens which come in contact with the nasal lining, and intranasal corticosteroids to suppress their symptoms of inflammation, excessive sneezing, and all those get control. We can treat them with a temporary course of even anti-allergics also, but we have to rule out first if they're what drugs they are taking. Is there any drug interaction with the and because there are a lot of anti-allergics having drug interactions. So we have to just rule that out before prescribing them. We have to be extremely careful in prescribing medicines to the elderly population.
Yes. And now, Mr. Sachin More's question. Suffering from allergic cough and cold since 2014. Nose operation was done in 2022, but I'm still suffering from the same problem. It is always stuffy nose and heavy cough. Can you please suggest any advice?
Yes. So if it is a chronic problem, better is to see an ENT doctor, get yourself examined, get a nasal endoscopy. Is there a mechanical block to the sinus drainage pathway? Or if it is purely allergic, you have to use prolonged use of this nasal sprays we can use. Whenever you are moving out in a dusty environment, use this mask as a barrier, and these are the best. And last but not the least, we can go for a treatment called as the immunotherapy, which is basically finding out the allergens which are causing the problem and gradually desensitizing them using incremental dosing of those allergens, so that there is a desensitization process which happens, and it is quite helpful, but it takes a lot of time. It takes
Yes.
sometimes 3 to 2 years, and it needs maintenance also. So immunotherapy is an option for allergic patients.
जैसे आपने बताया मेंटेनेंस के बारे में डॉक्टर आई थिंक साइनसाइटिस और साइनस की मैनेजमेंट इज मोर ऑफ मैनेजमेंट एंड मेंटेनेंस देन एक
Absolutely.
एपिसोड आया तो उसको मैनेज करो इट्स अ कंटिन्यूअस एंड कांस्टेंट अप्रोच टू इट
Yes. So it is particularly with those patients. एक किसी को अगर एक viral episode of sinusitis आया, it is usually managed. It is a self-limiting problem. Even if we don't treat them, the patient remains fine. But in patients who have atopy or who have allergy, their IgE levels are raised, and IgE is a basically marker in the blood which tells us allergy levels. So, who have tendency of family history of asthma in their family, allergy of allergic bronchitis, and all those symptoms. So they need long term maintenance. They have to manage their symptoms. And those are the best patients. Some patients have food allergies that can trigger sinusitis. So they are the best judge which food causes them or triggers the sinus episode of sinusitis. They have to just avoid.
Yes. So that was his question, and Sachin Moreji ka ho gaya. Next is Karthik Sundar Rajan's question. 40-year-old male. I have mild deviation of nasal septum and bilateral maxillary polyposis with antro channel polyp
Cornel,
or CHOANA.
anthroconal, cornel.
हाँ,
Yeah,
polyp on the left, reaching up to the nasopharynx, blocking the posterior CHOANA. Can you please suggest
quana. Yeah, quana.
Koana? Yeah.
Yeah. So if it is a enteroconal polyp reaching up to the corner, it certainly needs endoscopic sinus surgery. But again, as I told you, it all depends upon his symptoms. It is not an emergency. He can take his time. It is not, it is an elective surgery. It is, we should not be making it. Mild septum, he mentioned in the beginning, we can only correct if he has persistent blockage because of the septal deviation. Even some people have severe crooked central partition or the septum. They may not need septoplasty or surgical intervention because they don't have signs of blockage. Only those patients who have signs of persistent nasal blockage, they need septal correction. And because of this bone deviation, those patients who do not have persistent blockage in their nose, in spite of having a deviated septum or deviated crooked central partition, they don't need surgical intervention. It should be clear. Okay, but
Right.
enteroconal polyp reaching up to the nasopharynx and corner certainly needs intervention in the form of endoscopic sinus surgery.
All right. That was about Karthik's question. Next question is वर्ल्ड मीमर 26. इनका नाम और एज मुझे दिया नहीं है सर. इनका क्वेश्चन हिंदी में है, सो कैन आप जरा हिंदी में आंसर दे दीजिए.
Sure.
सर, एलर्जी नाक में बहुत एलर्जी है, नाक में बहुत जलन होता है, बहुत पानी बहता है नाक से. क्या सर मुझे साइनसाइटिस है? प्लीज हिंदी में बताइए.
यस, ये जो साइंस एंड सिम्टम्स है आपके नाक से बहुत पानी बहना है, इचिंग रहना है, दीज आर यूजुअली साइंस ऑफ एलर्जिक राइनोसाइनोसाइटिस. तो इन केसेस में अगेन जो आपके नज़दीक में ईएनटी विशेषज्ञ हैं या कोई भी हैं पास में, तो उनको एक बार आप दिखाएंगे और वो आपको कुछ मेडिसिन और नेजल स्प्रेज प्रिस्क्राइब करेंगे. शॉर्ट कोर्स ऑफ एंटी एलर्जिक्स इफ दे डोंट हैव एनी कॉन्ट्राइंडिकेशन, या फिर नेजल स्प्रेज हैं जो आपको कुछ महीनों तक यूज़ करने हैं, या फिर जिस सीज़न में एग्रीवेट होता है उस सीज़न में यूज़ करेंगे, तो ये आपका प्रॉब्लम सॉल्व हो जाएगा.
जी, ये वर्ल्ड मीमर की आंसर हो गई. एंड नेक्स्ट क्वेश्चन है पुनीत मेहता जी. हेलो सर, आई ट्राइड naturopathy, homeopathy, allopathy, ayurveda, and eventually got a surgery also done for the apparent deviated nasal septum, but I am still not relieved in any way. It's been 3 years right now. Anything else that I can do?
But what are the symptoms? I need to know the
हाँ,
symptoms. Surgery for what
ठीक है.
has been done?
Okay. So Puneet Mehta is from Bangalore. Is there any way that weather could be a factor in contributing to my condition? I do not understand this because I'm born and raised in Bangalore itself. So Puneet, I think you should type down what your symptoms are. We'll take Puneet's question in a while. I'll wait for him to type, and we'll wait for him to join us back. Um, so yes, Sachin Moreji say thanks you for giving a very detailed answer. He's from Nashik, Maharashtra, and I want to take a regular check at Apollo hospitals in Nashik. Who and how I can consult. So इनके लिए कहीं भी हो सकते हैं क्या? An ENT के साथ कितना consultation होना चाहिए डॉक्टर? And how frequently should they be visiting?
Yes, that question is better answered by the person who sees him for the first time. He
Sure.
will know what is the severity of the problem, how often he needs to visit the hospital or the ENT doctor. So that is only after clinical evaluation we can tell this.
बट जनरल तरीके से अगर मैं समझती हूँ, इफ आई हैव अ सिचुएशन विच इज रेकरिंग है या क्रॉनिक है या एलर्जिक या सीजनल है, तो मुझे वंस आई आइडेंटिफाई दैट आई एम दिस रिक्वायर्स वन लॉन्ग टर्म एटलीस्ट अंडरस्टैंडिंग, सो हाउ ऑफ्टन शुड आई गो एंड मीट माई ENT?
So there are two things to it now. What protocols I follow in patients whom I operate for nasal polyps or a deviated septum, what I do is I just see them 3 times for a patient of nasal septum deviation. The day I operate them, then I call them for there is a pack or sponge inside the nose. We remove it after 2 weeks. I usually keep a splint also, which helps me prevent recurrence of the problem. I remove it after 2 weeks, then I call them once in after 1 month, and then the job is done. But it is purely because of the septal deviation. In patients who have polyps in the nose, they need a long-term follow-up. Initially, 1, 7, and 1 month, day 7, 1 month, and then every 3 months I call them for follow up at least for a year, and then 6 monthly for 2 years, and similarly yearly after that, because these polyps have a tendency to recur also. So if you keep a check on them, The purpose of follow-ups in such patients is to avoid the need of a second surgery. Because
Right.
if we see early recurrence of polyps, they are coming back, we stage them based on nasal endoscopy from 0 to 4. If they are 0 1, they are 1 or grade 1 or grade 2 or grade 3, we can still suppress them using medicines, so just to avoid the need of a second surgery. But normally what happens when the patient gets operated, he thinks that he is cured of the problem and he goes away, never comes up for follow-up. There the problem lies, that the disease comes back.
So this is very important कि क्या follow up
Yes,
routine रहना चाहिए depends on what your doctor suggested, and do continue your follow ups, which is very very important for management.
very
Yeah,
important.
right. Yeah. And Molratan Singh is asking, 24-year-old, I have bacterial allergy and suffering from acne vulgaris within the ear. And being an ENT specialist, can you please suggest me ways to protect my ears from acne? I think this is not a question related to the sinus, but
Yeah,
one quick
no,
answer,
I
please.
would like to, I would like to answer him. It is not acne actually. There are people who have dandruff in the ear and eczema in the of the skin, so that can affect the ear canal. So yes, so in those patients, what we should be giving them treatment for the dandruff, so that because when the dandruff it affects your skull, it can affect your ear canal skin also. It's very sensitive. So they can visit their doctor, even a skin specialist or an ENT doctor, and the problem gets sorted.
Right. So that is your answer, Anmol. Puneet Mehta is written back, जिनका जो सर्जरी हुआ है and काफ़ी सारे ट्राई कर चुके हैं, but his symptoms persist बोला है. उन्होंने अभी लिखा है, he got a surgery done for a deviated nasal septum, septoplasty, and the symptoms are persistent, blocked nose, and more so often when I wake up in the morning, I have to blow my nose so hard to clear it. He's in Bangalore.
Okay. So there are three, four things which can be the cause of this blockage. Either it can be if there is a component of allergy to it which has caused it. Along with the septum, there are, to increase the purpose of nose is basically to condition the air, to add moisture to the air, which we breathe in. So there are structures, scroll-like structures, which we call as the turbinates. They're also there because of the allergy, chronic allergies. They increase in size. So that can be one of the causes. Inadequate correction of the septal, this thing by the surgeon. I don't know about the skill of the surgeon. So inadequate corrections can lead to persistent blockage in the nose. And these are the common reasons which have led to basically identifying the problem. If it is allergy, we have to treat the allergy also along with the septal creation, this correction. So this is very important.
Right. So, Doctor, here's Mahita's asked this question and you've answered it already. But she's worried if sinusitis in the long run will affect her vision.
Yes. Sinusitis, if it gets super added bacterial infection, or if it is invasive fungal sinusitis, so because the orbits or the eyes are in close proximity to these closed spaces, so it can affect the vision. But if it is just allergic rhinosinusitis or all those things, they usually don't cause any trouble. But
Right.
sinus is known to complicate. It can spread to adjoining structures.
Okay. Okay. Akash is asking nasal sprays, medicines, and इनके साथ मैंने काफी सारा mucus excrete किया है. Blockages got cleared. Pain also relieved quite a bit. I felt lucky, but I'm now scared about the surgery. Winters are approaching in Delhi. Will surgery help him?
Again, it is after evaluation. If there is a mechanical block, if there are polyps inside the nose, then certainly surgery is indicated. But if it is not, there is no mechanical blockage, it is just the inflammation and swelling of the lining of the nose or sinuses, we can very well control it using some nasal sprays, use of mask, nasal douching, and all those things. So there is no need of surgery if it is because of the swelling of, inside the nose. But if it is because of the crooked bone, if there is a mechanical block, road block, we need to clear it.
Yeah. quick questions from Puneet Mehta. He was asking continuous questions. If I've made a slight change in my diet where I don't take milk and eat only 2 meals a day, I feel much better. That helps him. But do advise on how to completely overcome. Does diet have some role on doing this, or are there any tests to confirm what is causing the allergy?
Yes, there are food allergies, but as I said, I won't be knowing about it. It is the patient who's the best judge for that. If a patient
Yeah.
gets triggers in their sinusitis consuming certain type of foods, better is to avoid. There are laboratories outside who are doing food allergies, a panel of, it's a battery of tests. So they are doing those kind of tests to identify which allergen is causing them, so they can go there and identify their food allergens.
But is that for everybody? Not every
No, it's
sinusitis will
not for
require.
everybody. No, no, no,
Huh.
no, no. Not for everyone.
Right.
It is if it gets a trigger consuming a certain food.
ऑल राइट डॉक्टर सर इनका नाम नहीं दिए हैं बीजीएमआई इनका उसके चैनल से अकाउंट से कर रहा है सर मुझे साइनसाइटिस की प्रॉब्लम है और मैंने कुछ एंटीबायोटिक कुछ एलर्जिक दवाइयाँ भी मैं लेता हूँ जब मैं एंटीबायोटिक लेता हूँ मेरे पाचन क्रिया खराब हो जाते हैं तो जैसे आपने बताया है कि एंटीबायोटिक सबके लिए नहीं है और स्पेशली साइनसाइटिस के लिए नहीं है तो डाइजेस्टिव सिस्टम पे इनका लोड बढ़ता है
यस, देर आर गुड बैक्टीरिया इन आवर गट. हमारे गट जो है, खाने का जो रास्ता है, स्टोमक है, इंटेस्टाइन्स है, उसमें गुड बैक्टीरिया भी होते हैं. और जब हमें एंटीबायोटिक्स इंडिकेटेड नहीं है और अननेसेसरली कंज्यूम कर रहे हैं, so that can affect the flora of the gut and that can lead to, in fact, that can be counterproductive also. वो वर्सन करेगा इस सिचुएशन को rather than helping you. So अगर आपने एंटीबायोटिक जब तक बैक्टीरियल इन्फेक्शन नहीं है, फीवर 2-3 डेज से नहीं है, या आपने अपने किसी लोकल ईएनटी को दिखाया है, if he has prescribed fine, but if he has not prescribed you and on the over the counter antibiotics ये सब चीज खुद ले रहे हैं तो better is to avoid that.
Absolutely. So, I completely forgot to ask you while I was asking the septuagenarian's question. I wanted to ask you about बच्चों के बारे में पूछना था, and it's about children and sinusitis. My nieces, the moment I see my niece, I'm reminded of my childhood where I suffered heavily with constant rhinitis, sinusitis. So, बच्चों में क्यों ज़्यादा होता है? Will they overgrow? Will they grow out of it as they grow older? Or is there something specific that we need to understand?
Yes. बच्चों में it can be sometimes it genetic tendency or atopy we call it. Allergy भी हो सकती है. There are certain kind of syndromes we call as this Carter syndrome या इस तरह की कुछ syndromes होती है वो भी हो सकती हैं. But an important and a very common cause of sinusitis in pediatric age group is adenoids. एडिनॉइड्स क्या होते हैं? जस्ट लाइक वी हैव टॉन्सिल्स इन आवर थ्रोट, इसी तरह लिम्फॉइड टिश्यू का एग्रीगेशन होता है बैक साइड ऑफ द नोज पे, जो कभी कभी बिकॉज ऑफ दिस एक्सपोजर टू दीज एलर्जेंस वो ग्रो कर जाता है बहुत ज्यादा, कॉम्प्रोमाइज करता है एयरवे को. उसके ऊपर बैक्टीरियल कॉलोनीज विच वी कॉल एज द बायोफिल्म्स डेवलप होती हैं. देर इज ए कॉन्स्टेंट पोस्ट नेजल ड्रिप. वो बच्चे यूजुअली कॉफ करते रहते हैं, रिकरेंट चेस्ट इन्फेक्शन होती हैं, रात को सोते हैं तो माउथ ब्रीदिंग करते हैं, माउथ ब्रीदिंग
Ah,
की वजह से उनकी फेशियल डेवलपमेंट इफेक्ट होती है. एंड सिमिलरली they have recurrent sinusitis, ear infections are common in those. So these kids should not, they must visit an ENT or a pediatrician to get those adenoids ruled out. If at all it is present and if it is causing significant compromised airway, उनको कुछ nasal douching, intranasal corticosteroids if more than 2 years of age हैं, अगर if it is helping fine, if it is not helping, adenoidectomy, endoscopic coblation adenoidectomy or any kind of adenoidectomy, आजकल it is a very safe option and it's a daycare surgery which is a painless procedure. It must be considered because अगर उसकी facial development affect होती है, उनका जो तालुआ होता है, हाई आर्च पैलेट होता है, ये दांत फॉरवर्ड आना शुरू हो जाते हैं बिकॉज ऑफ कांस्टेंट माउथ ब्रीदिंग. सो लेटर इन लाइफ once they achieve after 15-16 years of age, जब facial development stop हो जाती है, they need then complex orthodontic procedures, so which can be simply avoided using a simple procedure called as adenoidectomy.
correct. So this is about adenoids. How about allergies? There's so much of seasonal allergies बोलिए और pollution बोलिए और weather related or other allergies that children do catch.
Definitely, and similarly, हमें उनका जो जब when if there is a seasonal allergy or particularly Delhi, the winters are approaching. There will be a lot of smog in the air, and it is heavily polluted. AQI goes bad. So in those conditions, I think we should stop sending them to parks. जितना maximum possible हो सके उनकी outdoor activities को हमें कम करना चाहिए. We should keep them hydrated. We should encourage them to wear a mask whenever they move out or whenever they go to school. And these are the because the child, the lungs are growing, it severely affects it. I mean, I feel very bad. I have my kids also staying here in the the coming months. It will be
Yeah,
really bad situation.
I know
So
we do
it's
feel sad that we are unable to send our children out to be social. It's very important for their development going outdoors. But then, if it is
absolutely
compromising their health and safety, I think we should choose
no. I think
wisely.
for a few months we can always avoid it.
Absolutely, doctor. So I think that's for the children. But then, do we grow out of such allergies as we grow older?
Yeah, as I earlier also said, there is a process called desensitization which is happening parallelly. So the first response of body to to a foreign allergen is not the same when it again and again comes in line with the contact with the nasal lining. So the body starts recognizing it at its own, and the next responses they become weaker and weaker over a period of time, and they may also eventually get rid of. There are patients who have allergic symptoms, and eventually it settles down. So this can happen.
Yeah. Kartik Sundararajan ka follow-up question hai. We did answer his question earlier. Are there any side effects of surgery? And if अगर उन्होंने polyps का surgery करवाया, will they recur?
Polyps have a tendency of recurrence, as I told, but keeping a constant follow up is important to avoid the need of a second surgery. And surgery, if you ask me, there are theoretical complications of the surgery can happen because there are adjoining important structures like eye and brain. So it is important for them to choose the surgeon who's skilled, who's experienced in doing sinus surgery because complications are also known. It's not like it is devoid of complications. So the books also mention a lot of complications of sinus surgery, but if it is done properly by a skilled and an experienced surgeon, so usually it goes well.
या तो हमारे यहाँ स्पेशली साउथ में हम ये मानते हैं कि बॉडी में अगर गर्मी बढ़ जाता है तो आपको कोल्ड होता है उष्णम उष्णेन शीतलः करके एक हमारे यहाँ एक सेइंग भी है सो हियर रम्या
Hmm.
नागराज हु इज आस्किंग ड्यू टू बॉडी हीट इफ देयर इज कोल्ड विल स्टीम हेल्प इट सी फर्स्ट एंड फॉरमोस्ट वी नीड टू ऐड ये मिथ को डिबंक करना है उसके बाद में विल स्टीम हेल्प
Probably I'm not the right person to comment on that because I purely believe in science and uh, this garmi and sardi in the body. I think those concepts I don't believe in. Probably she should be asking it to the right person. And I'm not denying that science also, but at the same time, but I'm not the right person to answer that. But steam certainly help, but it should not be over steaming or use of over steam, and you should not be too close to the steam because it can burn the nasal lining and affect the nasociliary action. That is very important. Do take steam once or twice in a day maximum, and it should be gentle and should remain far away. Basically, the purpose is to soothe that area, not to harm it.
Yeah. To how do we differentiate between regular colds and the inflamed sinuses? Dikshit is asking, hello, I am Dikshit, 57-year-old. I have some phlegm passing through the throat in the posterior of the nose, which is hard to swallow, and at times I do feel that my throat is getting blocked. I feel some congestion in the nose. Is it different from sinusitis?
No, it can be part of the sinusitis. Sometimes these sinuses they get infected because of the stasis of the secretions. They constantly dribble from backside of the nose into the throat. We call it a post-nasal drip. So the post-nasal drip can be because of two reasons. One is backside of the nose is called nasopharynx. It can be because of the inflammation of nasopharynx also. We call it as chronic nasopharyngitis. Or it can be because of the sinus collections which dribble because part which is at the backside of the nose, it is more open, and gravity also plays an important role. Instead of coming out from here, it flows back in a wider area and it trickles down into throat, and that keeps troubling the patients. It becomes a cause for constant cough, throat irritations, recurrent throat irritations, and even hoarseness of voice, constant laryngitis, chest infections, and it becomes a cause of that. So they need
Yeah.
to visit the doctor. Let them find out the cause. Let them nasal endoscopy, sometimes CT scan. So all these investigation modalities, they help us in diagnosing a situation.
See, asking a question here on this online platform और कंसल्टिंग अ डॉक्टर ऑनलाइन जो कंफर्ट घर से होता है वो आपके ऑफिस में आने के लिए थोड़ा तकलीफ ही होता है द मोमेंट यू कॉल एंडोस्कोपी यू आर आई सी अ
No,
लॉट ऑफ
no, no,
पेशेंट्स
no.
हु आर सो
I know there are the patients are skeptical, but the endoscopy is a very generalized term used for the putting a scope through into the stomach. It is not like that. Basically, endoscopy of the nose and sinuses, it is a rod-like structure with a camera also fitted. We just see inside of the nose, we numb it. It is a painless procedure, and it takes hardly 5 to 10 minutes. And it does not need any general anesthesia or local anesthesia. We just keep a pledget of cotton inside the nose or spray it with a local anesthetic, and we see or visualize inside the sinuses. It is absolutely a safe and an effective procedure.
I wanted to bring this
Good
out
that you
because
asked this.
I,
Yeah.
yeah,
Yes.
because
Yes.
I have got my nasal endoscopy done with the fear of endoscopy का word जितना मुझे मेरे दिमाग में इतना create करके I had to tell myself, prepare myself and go to the and I was sitting on the ENT chair and endoscopy तो हो गया. It was just like that. I didn't even जितना मुझे
Yeah.
preparation करना पड़ा उतना आसान रहा. Than the preparation, the
No, it's a
procedure was
simple.
easy.
It's a very simple procedure done in OPD only. Just that we have a camera system, we visualize the inside of the sinuses and inside of the nose. Because with light only, we can see up to certain extent. The purpose of endoscope is see backside of the nose also, nasopharynx, sinus drainage pathways, वो सब चीजें देखना है ताकि वहां पे कोई identify कर सकें.
Right. So one quick last question. I'm not sure if it is topic of the day may आता है. Manjunath is asking suggestions about avoiding regular tonsil stones and are sinusitis causing tonsil stones. What are tonsil stones?
बेसिकली जो हमारे गले में जो टॉन्सिल्स होते हैं ही इज टॉकिंग अबाउट पैलेटाइन टॉन्सिल देयर आर मल्टीपल टाइप्स ऑफ टॉन्सिल्स
Ah,
आल्सो लिंगुअल टॉन्सिल्स
tonsillitis.
पैलेटाइन टॉन्सिल्स ही इज टॉकिंग अबाउट पैलेटाइन टॉन्सिल्स उनके बीच में देयर आर स्पेसेस व्हिच वी कॉल एज अ क्रिप्ट्स ऑफ द टॉन्सिल्स so the crypts of tonsils may sometimes food gets lodged in or the shedding of the lining of that area that gets accumulated there which leads to stone formation. It has got nothing to do with sinusitis and those can be removed manually. After every meal you just rinse your mouth with clean water. So just practice those things and your problem will be solved.
Wonderful. Manjuna, thanks for asking that question. So, these are the questions from our audience today. I think we will wrap up with the questions today. So, as far as I've understood, that sinusitis requires awareness and management. Can we have some top tips from you to manage sinusitis, please?
Yes, as the winters are also approaching, I would recommend any people who have this allergic or seasonal this outbursts of sinusitis. They should be preferring not to do outdoor activities. Use a mask. Keep sipping a lot of water. Keep your hydration good to wash out or flush out these allergens from the body. If it is possible to move out of places where it is heavily polluted to places which are less polluted, if it is possible, please do that also. Please follow it. And the barrier, of course, whenever you move out, please wear a mask.
Thank you, Dr. Noor. It was really enlightening today, and I'm so happy that our audience have been asking proactive questions and engaged so very well with you. It was wonderful seeing this
Thank you very
session.
much. Thank you very much. I'm also feeling blessed to have been of some kind of help to people around. So it's a pleasure. Thank
Thank
you
you.
very much.
Appreciate your time on Sunday morning. Thank you once again, Dr. Noor.
Thank you.
And
Thank you
here
so
I
much.
continue with my health quiz. 3 questions coming up on your screen. Please answer the questions on the chat of YouTube only. Winner's name will be announced towards the end of the show. If I take your name to be the winner, you have to mail your contact details to marketing@apollo247.org. Winners will be selected at the sole discretion of Apollo 24/7 team. Gift vouchers will be shared with you. Here are the 3 questions for today. And the first question is question number one. Runny nose, excessive sneezing, and pressure on the face are the common signs of fill in the blanks. S blank, N blank, S blank, T blank, S. What is the word there? Runny nose, excessive sneezing, and pressure on the face are the common signs of what? The blank. Question number two. Allergic sinusitis is contagious. Myth or fact? Allergic sinusitis is contagious. Myth or fact? Please do text your answer there. Question number three. All sinus problems do not need antibiotics. True or false? Question number three. All sinus problems do not need antibiotics. True or false? These are the questions for today. Please do type your answers in the YouTube chat only. And here, while you type your answers, we are giving away coupons that you can use on Apollo 24/7. The first one is Ask Doc 150. You get 150 rupees cash back on online doctor consultation. The next one that we're giving away is first three. Use the code FIRST3 to get 25% off on online medicine orders. And by the way, let me remind you, it's a 19-minute instant delivery in many of the cities. And if you want the instant delivery to be on your city, participate in the contest which is going on. For more details, check the Apollo 24/7's LinkedIn, where you can suggest advertisements, creatives, and get 50,000 rupees as cash prize as well. That is the instant delivery. So avail the instant delivery as well. The next one is exclusively for Health Hour viewers, HH247. That is 199 off on online consultation with Apollo doctors, 20% off on medicine orders as well. And Apollo 24/7 also can be accessed on WhatsApp. Here's the number 9355 247 247. This is the number that you can save and text or call just as you do on WhatsApp to get medicines as well. By the way, next week we are taking a Diwali break. It's going to be festivities week. So we wish you a very happy and safe Diwali. It's a no-show. Happy festivities. We shall see you post the Diwali festival. And I'm looking forward for the winners as we see who is all participating. Hargun, Avinash, Ramya, Abhishek. Oh, a lot of you are participating. While the team is selecting, let me tell you that the LinkedIn contest is all about how you want your city to participate in the 19-minute delivery of instant medicine delivery of Apollo 24/7. You can suggest the creative campaign, the lines, the advertisements, the creatives. You will find more details on the LinkedIn as well. And here are the winners for today. Mahita, Vivek Vasishta, and Karthik Sundar Rajan. I repeat, Mahita, Vivek Vasishta, and Karthik Sundar Rajan. Please do follow the rules to write back to us and claim your health credits. Happy Diwali to all of you. Wishing you ahead of the festival. Thank you and namaskar.